Hi there, my name's Flanagan. I work in intensive care in Myers Hospital as a clinical support worker. And the daily routine for myself for 12.5 hour shift would be getting up at about 5:30 in the morning, have a shower, get food and stuff organised for the day. I stay 5 minute drive from work, so I can leave about 20 to 7. Shift starts at 7 in the morning, come in, see the team who's on in the day, make a cup of coffee or tea, change out my uniform, and at 7 o'clock we get our morning handover of the patients and what's happening in the ward. And then about 7:15 we go into the unit and we start our job. And my main routine and job title in the unit is setting up all the life support machines, making sure that they are working order, and they're set up for emergency patients coming into A&E or theatre. We also make sure that we have enough equipment and drugs in the cupboard in the storeroom, so liaison with all the pharmacy departments, medical physics if any equipment needs to be fixed or repaired. That's about my day in the morning. We have breakfast about 9 o'clock in the unit, which is normally cereal, porridge, cup of tea. We get half an hour for a break, and if it's sunny we go outside, change our clothes and go enjoy some fresh air. Go back into the unit, and we normally get patients coming in from whether it's theatres or A&E or emergency patients coming from other wards, and that could take up most of the mid-morning until about 12 o'clock, 12:30 we get lunch. Normally that's just soup or a sandwich from the canteen, and we get about half an hour for that break as well. Later on in the afternoon is when we have visiting time, so a lot of interaction with the patients' families, carers, physios come in, do their ward rounds with the patients and hopefully get the patients home, and if so we get them all packed up ready for going home, whether it's that night or the next day. Visiting time lasts 2 hours in the unit, so about 4 o'clock patient visitors are going home and we start getting the beds ready for the later on patients coming from theatres. So that takes about half an hour, 40 minutes. All the staff get all the bed spaces set up, making sure that there's all the equipment set up, ready for the admissions from the theatre staff. Once we get a patient in from theatre, we get a handover, which takes maybe between 10-15 minutes. We get the patient settled in, and then we let the families know that their loved ones or families have arrived in the unit and they're safe, and they'll come up for visit between 6:30 and 8. So about 5:30 we'll go for a quick 15-minute break, cup of tea, chill for 15 minutes, back into the unit, and it's just getting the shift ready for the night shift to come in, which they start at 7 o'clock, and when they get their night shift handover they come in about 7:15 and we finish for 7:30. After that it's a quick 5-minute drive home, go for a walk usually if it's nice, have a shower, make food for work for the next day if I'm back on a long day, and if I'm back on for a long day it's maybe watch half an hour of The Big Bang Theory or something on Netflix for an hour max, in bed for about 10, 10:30, and back up again first thing in the morning.